Cirrhosis, presented by Bustulio Kate Maurice, Malyari Prisjehan, and Villarman Kathleen. What is cirrhosis disease? Cirrhosis occurs as an end stage of many chronic liver diseases, including biliary atresia and chronic hepatitis. Severe liver damage can be caused by infectious, autoimmune, or toxic factors and by chronic diseases such as hemophilia and cystic fibrosis. A cirrhotic liver is irreversibly damaged, although a healthy liver has a remarkable ability to repair itself. Chronic liver disease can lead to cirrhosis. In very young children, cirrhosis is most often caused by a genetic or inherited liver problem such as biliary atresia. So, unsa ba ang biliary atresia? Biliary atresia is a condition in infants and bile ducts outside and inside sa liver or kana mag-scarring ba siya or dili mapik kana magpiklat or na-block bitaw. Then, bile can flow into the intensity, so bile builds up in the liver and damage it. The damage leads to scarring, loss of liver tissue and function, and becomes cirrhosis. So, makuha na siya, madiscuss na siya sa sunod nga mo report. Then, um, cirrhosis can be in very young children. Cirrhosis is most often caused by a genetic or inherited liver problem such as biliary atresia. So, muna to kong giingon. In older children, conditions such as Wilson disease and autoimmune hepatitis can cause cirrhosis Japon. So, unsa day ang Wilson disease? Ang Wilson disease man is a rare autosomal recessive disorder caused by abnormal copper accumulation in the body, particularly involving the brain, liver, and the cornea. So, ma-discuss yapon ni siya sa amo ang sunod nga mo report. While cirrhosis in adults is often caused by heavy alcohol consumption, a mother or father drinking cannot cause cirrhosis in the child. So, ang incidence is, in a study conducted, only 6 or 1.8% of the 332 children evaluated developed cirrhosis after a period of 10 years. The incidence of hepatitis symptoms and severe liver disease was low.
So, anatomy and physiology. The liver is the second largest organ in the body, located in the abdominal cavity. The liver helps the body in many ways, like produces proteins that allow blood clot normally, transport oxygen and support the immune system, stores extra nutrients, and then produces bile, a substance that helps digest food, helps clean the bloodstream of harmful substances, and lastly, helps control blood sugar and cholesterol. And liver also that has ability to regrow. Like ang 75% is ang part sa liver is pag mawala siya, like siguro i-transplant, and then ang 25% is maabilin sa imo ang sa imong system, na siya possibility na mo regrow siya iya. And then pag normal lang imo ang function sa imong liver, like wala siya complications, and also wala siya cirrhosis.
Causes. Causes for adult is alcohol abuse, hepatitis, and fatty liver. Sa alcohol abuse, excessive and chronic alcohol consumption is the most common cause of liver cirrhosis. Cirrhosis from drinking alcohol can develop over many years. It is important to remember that the amount of alcohol that will damage the liver can vary from person to person. If a healthy woman drinks the same amount of alcohol as a healthy man, she has a higher risk of cirrhosis. Children are particularly susceptible to damage from alcohol. Some people also have a genetic predisposition to alcohol related liver injury. People with a medical condition, especially those affecting the liver, may have a higher risk of damage from alcohol. If you already have hepatitis B or C or cirrhosis of the liver, you are at risk of making your condition worse if you drink alcohol. Sa hepatitis is a general term meaning inflammation of the liver. Viral hepatitis is hepatitis caused by a virus like the hepatitis B or C virus. Chronic hepatitis C is a common cause of liver cirrhosis. Hepatitis B can also cause cirrhosis also. With either of these conditions, you increase your risk of developing cirrhosis if you drink alcohol. Fatty liver, non-alcoholic fatty liver disease can lead to inflammation of the liver and the formation of a scar tissue, a condition called non-alcoholic steatohepatitis or the NAHS, which can lead to cirrhosis of the liver. NAS usually occurs in people who are obese, have diabetes, or have high blood cholesterol, and triglycerides. So controlling these conditions is recommended. For children, biliary atresia, autoimmune hepatitis, Wilson disease, cystic fibrosis, and the fatty liver disease also. So, in children, biliary atresia is a blockage of the ducts that allow bile to pass from the liver to the gallbladder and intestines. Autoimmune health hepatitis, a disorder of the immune system that causes immune cells attack the liver as if it were an infection. Wilson disease, an uncommon inherited disorder in which the body cannot rid itself of excess copper found in many foods and allows copper to build up in the liver. Cystic fibrosis can lead to liver disease by causing mucus to build up and block bile ducts in the liver. This prevents bile from leaving the liver, which causes inflammation and produces scarring or fibrosis. As a result, the liver cannot function properly. Fatty liver disease, a buildup of fat in the liver that can lead to scarring.
So, in addition, for the causes for the children is that bilar atresia, ang bilar atresia, ang defect niya is ang bile ducts, which is the inflamed. So, ang function man gud sa bile ducts is that uh, ang mga waste product maagi siya sa bile ducts padulong sa intestine. But then sa biliary atresia is na-inflame man ang bile ducts, so dili na kaagi ang mga waste na dapat padulong sa intestine. So therefore, ang mga waste products is naara siya sa liver. So mo to siya magka-inflame na to siya. Mo to ang biliary atresia. And then next is autoimmune hepatitis. So, it is a chronic and progressive condition involving inflammation and damage injury of the liver. So, ang immune system is atakihon ang atong immune system is atakihon niya ang liver, and then muna siya magka-damage na to din siya sa ato ang liver. And then next is Wilson disease. So our body only needs about 0.75 grams of copper from we eat, and then the excess copper is excreted into the bile. In Wilson disease, there is a genetic defect that results in the excess copper being kept in the body and deposited in various tissues where it is not supposed to be. And then next is cystic fibrosis. So ang bile is becomes thicker and difficult to flow easily through the bile ducts and out to the liver. So dito na siya mag-irritate to then ang tissues and causes scarring and leads to a fibrosis. So lastly is fatty liver disease. Sorry. So Fats builds up inside the liver, and although storing fat is a primary function of the liver, too much of it can prove to be dangerous. So the buildup of fats can cause inflammation inside the liver, further causing damage and scarring, and the scarring can result in liver failure and not treated early.
Next is pathophysiology. Cirrhosis occurs as a result of hepatocyte injury with necrosis, fibrosis, regeneration, and eventual degeneration. The diminished parenchymal cell mass causes regeneration of tissue with nodular areas of proliferating hepatocytes that stretch the surrounding connective tissue. Hepatocytes respond to injury with disposition of collagen that forms fibrous connective tissue. This scar tissue and nodular areas of regeneration impair the intrahepatic blood flow. Ongoing necrosis and self-perpetuation of this pathologic process are the result of cirrhosis. Failure of hepatocellular function and portal hypertension occur and often lead to complications including ascites, severe cholestasis, encephalopathy or hepatic coma, and GI bleeding. So, the cirrhosis kay mahitabo siya tungod sa hepatocyte injury, which is ang hepatocyte kay mao na siya ang main cell sa parenchymal tissue sa liver. This also includes necrosis, which is death of body tissue usually occurs when too little blood flows to the tissue. Then fibrosis, which is formation of an abnormality large amount of scar tissue in the liver. Then regeneration, after the damage all liver cells change and divide with the normal size of the liver is restored. So, ang ato ang liver has the ability to heal itself man. Pero, if severe damage, kay mag-require jud siya og liver transplant. Then, degeneration. Hepatocerebral is a brain disorder that occurs in people with liver damage. So if ang cells gani kay ma-damage, usually that dead tissue that was previously full of living cells mahimong fibrotic. It means it becomes thickened with protein and forms scar tissue. So due to etiology factors like severe alcoholism, then exposure to viruses like HPV or other causes, so ang liver can be seriously scarred and damaged na dili na siya reversible. So usually kay ang ato ang liver kay reversible man na siya ability nga ma-heal niya ang itself first. Pag severe, of course, kailangan na jud og transplant. So since irreversible naman ang cirrhosis, ginatawag sad ni siya og end-stage damage sa liver.
So next is the risk factors. So first is the chronic hepatitis. The liver is a vital organ that processes nutrients, filters the blood, and fights infections. When the liver is inflamed or damaged, its function can be affected. And the next is excessive alcohol intake, and then fatty liver disease. So fatty liver may cause no damage, but sometimes the excess fat leads to inflammation of the liver. This condition called steatohepatitis does cause liver damage. Sometimes inflammation from the liver, fatty liver, is linked to alcohol abuse. This is known as alcoholic steatohepatitis. And the next is the Wilson disease, an inborn error of metabolism that prevents the body from eliminating copper. So the buildup of copper in the body damages certain organs, including the liver, nervous system, brain, kidneys, and eyes.
Clinical manifestations. Jaundice. As the disease progresses, bile flow is blocked or stopped, and jaundice, which is yellow skin or eyes, appears. The same bile pigment, bilirubin, which is responsible for the yellow skin tones of jaundice, can turn urine dark. Bleeding and bruising can occur more easily and take longer to heal. Next is poor growth. Cirrhosis may make it more difficult for the body to process nutrients, leading to weakness and weight loss.
anorexia, and liver decompensation. This leads to poor dietary intake, metabolic changes characterized by elevated energy expenditure, reduced glycogen storage, an accelerated starvation response, and protein catabolism result in muscle and fat wasting, and malabsorption renders the cirrhotic patient unable to fully absorb or utilize food that has been consumed. Muscle weakness. Some people with cirrhosis loses bone strength and is at greater risk of fractures. Loss of skeletal muscle loss is the major component of malnutrition and occurs in the majority of patients with liver disease. Lethargy. The liver is central in the pathogenesis of fatigue because it uniquely regulates much of the storage, release, and production of substrate for energy regeneration. It is exquisitely sensitive to the feedback, controlling the uptake and release of these energy generation substrates. Ascites is a buildup of fluid in your abdomen. It often occurs as a result of cirrhosis, a liver disease. When you have cirrhosis, your liver doesn't function as it should. The decrease in liver function combines with portal hypertension is high pressure in the portal vein that delivers blood to your liver. The high pressure causes fluid to leak out of your veins into your belly and collect there. Next is edema. Cirrhosis slows the regular flow of blood through the liver. This increases pressure in the vein that brings blood to the liver. Swelling in the legs and abdomen. The increased pressure in the portal vein can cause fluid to accumulate in the legs, called edema, and in the abdomen, called ascites. Edema and ascites also may happen if the liver can make enough of certain blood proteins such as albumin. Next is GI bleeding. Patients with liver cirrhosis may develop upper gastrointestinal hemorrhage from a variety of lesions, which include those that arise by virtue of portal hypertension, namely gastroesophageal varices and portal hypertensive gastropathy, and other lesions seen in the general population. Anemia. One of the major and potentially treatable causes of anemia in patients with liver cirrhosis is acute or chronic blood loss into the gastrointestinal tract, often resulting in iron deficiency anemia. The hemorrhage is usually secondary to complications of portal hypertension, such as gastroesophageal variceal rupture, gastropathy, gastric antrovascular ectasia, or peptic ulcers, more common in patients with cirrhosis.
Next is the complications. So, ang complications niya is high blood pressure in the veins that supply the liver. So, kani siya ang condition nga is known as portal hypertension. Cirrhosis slows the regular flow of blood through the liver. Kani siya ang mo-increase ang pressure sa atong veins nga mao'y nagdala og blood sa atong liver. Then, next is the swelling in the legs and the abdomen. The increased pressure in the portal vein can cause fluid to accumulate in the legs, called edema, and in the abdomen, called ascites. Edema and ascites also may happen if the liver can make enough of certain blood proteins, such as albumin. The next is the enlargement of the spleen. Portal hypertension can cause the spleen to trap white blood cells and platelets. This makes the spleen will a condition known as splenomegaly. Fewer white blood cells and platelets in your blood can be the first signs of cirrhosis. Next is the infections. Of course, if you have cirrhosis, your body may have a hard time fighting infections. Ascites can lead to bacterial peritonitis, a serious infection. Then next is the malnutrition. Cirrhosis may make it more difficult for your body to process nutrients, leading to weakness and weight loss. Then build-up of toxins in the brain. A liver damage by cirrhosis can clear toxins from the blood as well as the heavy liver can. These toxins can then build up in the brain and cause mental confusion and difficulty concentrating. This is known as hepatic encephalopathy with time. Hepatic encephalopathy can progress to unresponsiveness or coma. Then, bone disease. Some people with cirrhosis lose bone strength and are at greater risk of fractures. Liver cancer. A large proportion of people who develop liver cancer have pre-existing cirrhosis.
The next is diagnostic testing. First is the liver biopsy. Tests used to diagnose liver conditions. Tissue samples are removed from your liver and checked under a microscope for signs of damage or disease. A liver biopsy can tell if there are cancer cells or other abnormal cells in your liver. Next is the liver scan. May be done to look for diseases such as cancer, hepatitis, or cirrhosis. It can also see if your liver or spleen is larger than normal. It can be used to further evaluate known masses in the liver. A liver scan may be done to see how well the liver or spleen is working after trauma to the belly. Next is computed tomography or CT scan. Can provide more detailed information about the liver and gallbladder and then related structures that regular x-rays of the belly. CT scans can give healthcare providers more information about injury or diseases of the liver, gallbladder, and biliary tract. Next is esophagoscopy, a procedure in which a flexible endoscope is inserted through the mouth or more rarely through the nares and into the esophagus. The, endos- the endoscope uses a charge coupled device to display magnified images on a video screen. Next is the paracentesis. Paracentesis is done when a person has a swollen abdomen, pain or problems breathing because there is too much fluid in the abdomen or ascites. Normally, there is little or no fluid in the abdomen. Removing the fluid helps relieve these symptoms. The fluid may be examined to help find out what is causing the ascites. And then lastly is the percutaneous transhepatic cholangiography or PTC. The doctor pulls a long thin needle through the skin into the liver and bile ducts. Then they take x-rays to the pancreas, gallbladder, and then the bile ducts.
Therapeutic management. Cirrhosis can lead to complications in many organs and systems in the body. Regular checkups and monitoring enable clinicians to keep a close eye on the child and treat complications early. This may include patient with cirrhosis will be given diuretics to reduce swelling in a child's legs or abdomen. Since one of the common signs and symptoms with cirrhotic patients is ascites or edema. Then, regular screening for esophageal viruses in large veins on the lining of the esophagus. Regular screening for portal hypertension or hepatopulmonary syndrome. Then, severe cirrhosis is considered as a stage of chronic liver diseases. Two of the most serious risks of cirrhosis are liver failure and liver cancer. So, if either of these conditions develops, the child may need a liver transplant. Next is Kasai procedure. The Kasai procedure involves removing the blocked bile ducts and gallbladder and replacing them with a segment of your child's own small intestine. This segment of intestine is sewn to the liver and functions as a new extrahepatic bile duct system. Nursing diagnosis and interventions. Risk for impaired liver function. Interventions. Note client history of known or possible exposure to virus, bacteria, or toxins that can damage the liver. Review results of laboratory tests, example, abnormal liver functions, studies, drug toxicity, HVB positive. Obtain vaccination when appropriate. Some hepatitis strains, example given A and B, are preventable, thus minimizing the risk of liver damage. Encourage the client with liver dysfunction to avoid fatty foods. Fats interferes with normal function of liver cells and can cause additional damage and permanent scarring to liver cells when they can no longer regenerate. Next is imbalanced nutrition, less than body requirements. Nursing interventions. Encourage the client to eat, provide salt substitutes if allowed, restrict intake of alcohol, raw or uncooked food, and excessively fatty foods. Encourage frequent mouth care, especially before meals. Encourage physical activities as tolerated.
Next is nursing diagnosis is excess fluid volume may be related to compromised regulatory mechanism and excess sodium or fluid intake, possibly evidenced by generalized abdominal edema, weight gain, dyspnea, BP changes, positive hepatojogular reflex, change in mentation, altered electrolytes, change in urine specific gravity, and pleural effusion. Nursing interventions. Encourage bed rest when ascites are present. Restrict sodium and fluids as indicated. Provide adequate calories and protein. Administer medication as indicated, such as diuretics, such as spironolactone and furosemide, positive entropic drugs and arterial vasodilators, V2 receptors antagonist. Then, next nursing diagnosis is risk for impaired skin integrity. The nursing interventions is gently massage bony prominences or bit of body text, encourage and assist the client with repositioning on a regular schedule, suggest clipping fingernails short, provide mittens, gloves if indicated.
Next is the nursing diagnosis of risk for bleeding. Nursing interventions. One is encourage the use of a soft toothbrush and electric razor, avoiding straining for stool, vigorous nose blowing, and so forth. And then second is use small needles for injections. Apply pressure to small bleeding and venipuncture sites for longer than usual. And then third is administer supplemental vitamins such as vitamin K, D, and C. Use caution with vitamin A and iron supplements. And then lastly, educate the client to avoid swallowing foods that are chemically or mechanically irritating.
That's all for cirrhosis. Thank you and God bless.